What if I told you that three things you probably eat or drink every day are silently and systematically enlarging your prostate, tearing you from sleep night after night, and making your life miserable? What if I revealed that this enlargement isn't inevitable, that you don't have to live with it, and that there's a scientific protocol that can dramatically reduce your symptoms in 90 days, often without medications or surgery? I'm Michael Turner, urologist, and over the past 20 years, I've treated thousands of men with enlarged prostates. Today, I'm going to tell you the brutal truth about benign prostatic hyperplasia. I'm going to expose the three food saboteurs worsening your problem and give you a clear, practical path to regain control. Stay until the end, because this information could save you years of unnecessary suffering. Welcome. Let me start with a story you'll recognize. Robert, 62 years old, retired engineer, married for 35 years. Robert came to my office exhausted and frustrated. He said, "Doctor, I get up 4 to 5 times every night to urinate. When I finally get to the toilet, it takes forever for the stream to start, and then it's so weak, just a trickle. I never feel completely empty. During the day, I constantly need to know where the nearest bathroom is. I've stopped going out with friends because I'm afraid I won't make it to the toilet in time. My wife now sleeps in the guest room because I keep waking her up. Is this my life now?" I examined Robert thoroughly. A digital rectal exam showed a significantly enlarged but smooth prostate. His PSA level was slightly elevated, but not alarming. An ultrasound confirmed it. His prostate had reached twice the normal size and was compressing his urethra like someone standing on a garden hose. The result? Weak urinary stream, incomplete emptying, constant urge to urinate. Robert had classic benign prostatic hyperplasia. Here's the reality. After 50, almost all men's prostates begin to grow. By age 60, about 50% of men have some enlargement. By 80, it's over. Nobody knows exactly. But it's related to hormonal changes, especially the conversion of testosterone to dihydrotestosterone, DHT, by an enzyme called 5-alpha reductase. DHT is a potent androgen that stimulates prostate cell growth. The prostate surrounds the urethra directly below the bladder, like a donut around a straw. When it grows, it squeezes the straw. The result is the symptoms Robert had: weak urinary stream, hesitation when urinating, dribbling at the end, feeling of incomplete emptying, frequent urination, especially at night, sudden urgent need to urinate. But here's what most men don't know. Your lifestyle, especially your diet, has an enormous impact on how fast your prostate grows and how severe your symptoms are. And three things you probably consume daily are pouring gasoline on the fire. Saboteur number one: alcohol, especially beer. Alcohol is a diuretic. It increases urine production. But there's more. Alcohol directly irritates the bladder and prostate, leading to frequent, urgent urination. And beer? It's even worse. Hops in beer contain phytoestrogens, plant compounds that act like estrogen. Excess estrogen, combined with DHT, can promote prostate growth. Studies show that men who regularly drink alcohol have more severe BPH symptoms. When Robert drank 2 beers every evening, which he'd done for decades, he was guaranteeing himself a terrible night. Saboteur number 2, caffeine, especially after 2 p.m. Coffee, energy drinks, cola. Caffeine is a powerful bladder irritant. It increases urine production and makes the bladder muscle hyperactive, leading to sudden, uncontrollable urges to urinate. For a man with BPH, caffeine after lunch is like pouring gasoline on a fire. Robert drank 4 cups of coffee a day, the last one at 4 p.m. That was a direct contributor to his nighttime misery. Saboteur number 3, red meat and saturated fats. This is where it gets scientific. Diets high in red meat and saturated fats promote inflammation throughout the body, including the prostate. Chronic inflammation is a key factor in BPH progression. Additionally, these diets often increase body weight, and obesity is strongly linked to more severe BPH. Belly fat produces producins, which, as we said, promotes prostate growth. Robert loved his daily steak and sausage. It was delicious, but it was making his prostate bigger. The solution: the 90-day prostate shrinkage protocol. When I explained to Robert the connection between his diet and his symptoms, he was shocked, but he was also determined. I gave him a protocol, the same one I'm going to give you now. Pillar 1, eliminate the 3 saboteurs. Alcohol, especially after 6 p.m. Stop completely. If you must drink, limit it to 1 glass of red wine with dinner, no later. Caffeine, after 2 p.m. Eliminate. No coffee, no black tea, no cola in the afternoon or evening. Red meat, limit to once per week. Switch to lean poultry, fatty fish like salmon, plant proteins like lentils. Pillar 2, integrate prostate shrinking foods. Tomatoes, cooked, not raw. Lycopene, the antioxidant in tomatoes, is highly concentrated when cooked. Studies show lycopene can slow prostate growth. Cruciferous vegetables, broccoli, Brussels sprouts, cabbage, they contain sulforaphane, which can reduce DHT production. Pumpkin seeds, rich in zinc and plant sterols that support prostate health. Green tea, rich in catechins, antioxidants that reduce inflammation. Fatty fish, omega-3 fatty acids, are powerfully anti-inflammatory. Pillar 3, the nighttime fluid protocol. The rule: 80% of your fluid intake before 6 p.m. After 6 p.m., only small sips if necessary. Double voiding, 30 minutes before bed. Go to the bathroom after urinating. Stand up, lean slightly forward, sit back down, try to push out more, then right before bed, go again. This helps empty the bladder as completely as possible. Pillar 4, targeted supplements that work. Saw palmetto, sereno, repens, 320 mg daily. Multiple studies show it reduces BPH symptoms by inhibiting 5-alpha reductase, beta-sitosterol, 60 to 130 mg daily. Improves urinary flow. Peguum, African plum extract, 100 to 200 mg daily. Reduces nighttime urination. Zinc, 15 to 30 mg daily. Essential for prostate health, all with medical approval. Pillar 5, Kegel exercises for men. Yes, Kegels aren't just for women. Strengthen your pelvic floor. Contract the muscles as if trying to stop urinating midstream. Hold 5 seconds. Relax 5 seconds. 3 sets of 10 reps daily. This improves bladder control and helps with complete emptying. Pillar 6, weight management and exercise. Every kilo of belly fat lost reduces estrogen and inflammation. Goal: 5 to 10% weight loss if overweight. Aerobic exercise, 30 minutes, 5 times per week. Strength training, 2 to 3 times per week. Back to Robert. After 90 days on this protocol, he came back beaming. Doctor, I'm only getting up once or twice a night now, sometimes not at all. My stream is stronger. I actually feel empty. My wife is back in our bed. I have my life back. His ultrasound showed a slight reduction in prostate size, but more importantly, his symptoms were reduced by 70%. When are medications or surgery necessary? For some men, lifestyle changes aren't enough. Medications, alpha blockers like tamsulosin, relax prostate and bladder neck muscles, making urination easier. 5-alpha reductase inhibitors like finasteride shrink the prostate by blocking DHT. Surgery, if medications don't help or complications occur. Complete urinary retention, recurrent urinary tract infections, bladder stones, kidney damage, then procedures like TURP, transurethral resection of the prostate, may be necessary. Warning signs: see a urologist immediately. Blood in urine, inability to urinate, severe pain, unexplained weight loss. These can indicate prostate cancer or other serious problems. In conclusion, BPH is not inevitable. You have more control than you think. 3 simple eliminations. Alcohol in the evening, caffeine in the afternoon, excessive red meat can be transformative. Combined with prostate-supporting foods, supplements, and habits, you can reclaim your life. If this video has given you hope, subscribe for more men's health protocol. Share it with every man over 50 you know. Start the protocol today. In 90 days, you'll feel the difference. I'm Dr. Michael Turner. Your prostate deserves proper care. Until the next video.